Let us look at the heart model to understand where is the aortic valve located. We had opened the heart and then we had talked about these two valves on the left and right of the heart chambers. There are two more valves which are located at the bottom of these big arteries which are coming out of the heart. This grey artery is called the pulmonary artery, which is taking the deoxygenated or the impure blood to the lungs for purification, and red is the aorta, which is coming out of the left ventricle and is taking the pure oxygenated blood for circulation to the entire body. At the bottom of this aorta and at the junction of this left ventricle with the aorta, there is a valve located here which is called as the aortic valve. The aortic valve normally has three cusps. In a congenital disorder called as bicuspid aortic valve, there are only two cusps, and this also is liable for stenosis or narrowing. When the narrowing of the aortic valve becomes very severe, this particular chamber, which is the left ventricle, has to pump the blood against a lot of resistance offered by the narrow aortic valve. And therefore, over a period of time, weeks, months and years, this chamber becomes hypertrophied, which means becomes thicker and thicker. And then the oxygen demands go on increasing. But eventually, when it gets completely tired, one gets what is called as left ventricular failure. And the person begins to experience a lot of symptoms, and these symptoms are usually in the form of breathlessness while walking. There can be extreme degree of fatigue. Patient can experience sudden loss of consciousness or what is called as syncope due to critical narrowing of the heart valve. There is not enough blood going to the brain. When someone develops these symptoms, it is time to get investigated as soon as possible.